So over to you, Dr. Savli.
A very good afternoon, everyone, and thank you very much for inviting me here. So I'm going to be talking about strabismus, and I would like to ask you, the audience, what is the first thing that comes in your mind when you hear the word strabismus? Anyone? I don't have much time. So the most common answer that I get, it's difficult. Some people like to call it boring. And if I beg your pardon, but the judges might say, go to the next talk because we don't want to hear strabismus. Okay. So we are left a handful of very dedicated pediatric ophthalmologists in the country. In fact, only 11 centers that offer a fellowship in pediatric ophthalmology. It's one of the least preferred branches. Even after doing a fellowship, people like to combine it with a cataract surgery in order to make our specialty a little glamorous. So what, as a result, is that even basic strabismus surgeries are performed at tertiary centers. It's a time-consuming branch, and there are difficult algorithms, and people often ask, what is the dosage that you operate on? The traditional diagnostic methods are based on cover tests. It requires clinical knowledge. What inferior oblique overaction I see, my fellow doesn't see. So it is limited by the uncooperativeness of the child coupled with the objectiveness that it has to the specialty per se. Concerns for the patient are manifold. This patient created my Instagram profile because she was so bothered with her strabismus after surgery, and I often quote her example because we forget how psychologically traumatic this condition might be. Job opportunities are less, and not to forget, it causes a large chunk of childhood blindness. Keeping that in mind, we wanted to integrate the use of AI into making a device that can detect strabismus, classify it, and also quantitate it. So what we did was we recruited about 300 patients of strabismus with a handheld and the smartphone camera. We took the same photographs by the same observer at a fixed distance, fed it to a machine, and trained the machine using YOLO and efficient NetB, which are convoluted neural networking. And the algorithm was trained to first classify strabismus and then to quantitate it. These quantification was based on Canthai recognition by the software, by the pupillary center recognition, and it has a lot of technological aspects to it, but by and large it involved input of a facial image. The machine kind of segregates it, segments it into an eye region, identifies the landmarks, and gives you a severity index, horizontal as well as vertical strabismus. To confuse you more, these are confusion matrices which actually told us that our algorithm was working 94 to 97% of the time accurately, and it was actually matching with the refractive errors that with the prism diopter readings that we were obtaining in the clinic, with the absolute error to the last table, 0.02. So it's a suggested method to objectify the readings. We have an algorithm which can tell you, using deep learning, what is the strabismus. The patient can use it, the surgeon can use it, and then you can quantify it, and it is no longer limited by the inter-observer variability because it has an AI component to it. It will facilitate our numerical assessment, and it will set the stage for further AI-enhanced ophthalmology in strabismus, also telling us dosages and what muscle to operate and how much to operate. The current status is that we have built the software, it's applied for a patenting. We are testing it on different age groups and building a hardware component onto it because we require some funds for it. We at PGI are collaborating with the Thapar Institute of Technology. Without this, it would not have been possible. And the future vision is to make it more scalable, more reproducible, add more and more images to make it better and useful for everybody at the community level, at the hospital level, and then even at the patient level. Thank you.
Very nice.
It's a nice idea, but who do you want this app? Do you think it'll
It's
help
not
you
an
in
app,
training
sir.
or?
It's not an app right now. It's an algorithm which is built into a device. At present, we are planning to use it in the hospital first to see whether you can have, say, a kiosk where the patient can, just take a photograph and it can tell you whether you require a referral or not. It can be used at centers which do not have strabismologists, then refer the patient, telling them that this patient might require surgery. And in the app, we were thinking make it for the patient so that if sometimes patients have pseudostrabismus and they think that they have it, so if the app can tell you, yes, you have a strabismus, then, but the app is not on our mind right now. The first idea is to make it for the hospital and for the clinician.
How many images you have given for that deep learning thing or for the machine learning thing?
It was divided into a 70-30 data set. for training and for validation. So I had around 300 which the algorithm was trained on, and I've fed another 200 for validation for the quantification part. But I'm still in the process. of
How
doing
many
it.
normal
300
images?
is not good enough.
is
no?
not
It's not a good amount for
yeah,
deep
it's a
learning, yes.
less
But
less
it has
number.
never been done, sir, so it is the first time. We
Yeah.
are still into the process. We plan to do about 1800, and that's our...
how many normal images?
normal,
how many
sir, when-
exo? How many ISO? That way.
I do have that
vertical.
data.
Nahin,
So
just you can
mostly it
just-
was ISO and exos to begin with, by and large. So a rough number was that we fed 300, and then we had 182 controls to begin with. Then we added 200 more to validate. For validation, we did not put the controls because quantification did not require a control group. It's a
And
normative.
photos were taken on mobile.
This was taken on a 12 megapixel smartphone camera by one of our residents.
And from a fixed distance.
It was a fixed distance in a fixed room, but the algorithm is also made like that it standardizes. Even if you take it from some other phone, it will standardize, segment it, orient it, tilt it. Even brightness would be made uniform across the images, so that before you quantify, you have a
And it can
standard.
identify head tilt also.
I would want to say yes, maybe in the next time I present this, but right now we are correcting the head tilt to get the strabismus, because strabismus will manifest once you are correcting the head posture.
Thank you.
Okay.
Thank you.